All right, today we're tackling a condition that can feel like your body's accelerator is just stuck to the floor. We're talking about Graves' disease. It's an autoimmune thing that basically puts your thyroid gland into total overdrive. So we're going to break down exactly what that means, how doctors treat it, and, what life looks like once you're on the other side of that diagnosis. So let me ask you this. Do you ever feel like you're just constantly on edge? Anxious, maybe a little shaky, always feeling hot when everyone else is grabbing a sweater? And what about a heart that feels like it's running a marathon, even when you're just sitting still? Well, that's not just a sign of a really stressful day. It could actually be the classic calling card of an overactive thyroid. Yeah, that feeling of being stuck in overdrive, that has a name. It's called hyperthyroidism, and it all comes down to your thyroid gland. Just think of that small, butterfly-shaped gland in your neck as your body's master control system, kind of like a thermostat for your house or the accelerator pedal in your car. When it starts pumping out way too much hormone, it basically just cranks up the speed on everything, every single function in your body. Okay, so what's making the whole system go so haywire? Well, for most people, the main culprit is an autoimmune condition, and it's called Graves' disease. Graves' disease is really a classic case of mistaken identity. See, your own immune system gets confused, and it creates these antibodies that go after your thyroid. But here's the twist. Instead of destroying the gland, these antibodies act like a key stuck in the ignition, constantly telling it to go, 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 and produce way too much hormone. It's this friendly fire situation that's behind a huge number of cases. We're talking 60 to 80% of all hyperthyroidism. All right, so you're feeling all these symptoms. How do you actually get a clear answer? Let's dive into the process for unmasking the culprit here, which is, of course, getting that diagnosis. Okay, so doctors have a few key tools in their belt to nail down a diagnosis. First up, it's always going to start with blood work. They're checking your hormone levels, looking for low TSH, which is the thyroid-stimulating hormone, and high levels of the actual thyroid hormones like T4. After that, they'll hunt for that very specific antibody, the one that's actually causing all the trouble. And to really see what's going on, they might do a scan using a tiny bit of radioactive iodine to see if the whole gland is lit up and overactive, or even a Doppler ultrasound, which can show all that extra blood flow, a dead giveaway for Graves. So, you might be wondering, who's most at risk for this? Well, it's a mix of factors, but honestly, the scales are tipped big time towards genetics. In fact, it's estimated that your genes account for a whopping 79% of your risk. The rest, that comes from environmental stuff, things like stress, and one really big one, smoking, which can act as a major trigger. Okay, so once you have that diagnosis in hand, you get to a really important point in the journey, what I like to call the treatment crossroads. This is where you and your doctor team up to figure out the absolute best path forward, just for you. And look, there's no single right answer that fits everyone. The journey from here really involves making a choice between three pretty different paths, and yeah, each one comes with its own set of pros and cons. So here's the breakdown. Path number one is anti-thyroid medication. This gives you daily control, it's non-invasive, but the downside is that relapse rates are pretty high once you stop. Then you have the other two paths, radioactive iodine, or RAI, and surgery. Now, these are considered definitive cures. They get rid of the problem for good. But, and this is a big bet, they both pretty much guarantee you'll end up with the opposite problem, hypothyroidism, and need to take thyroid replacement pills for the rest of your life. So the real question you have to ask yourself is, do I want to manage this day to day, or do I want a permanent, irreversible fix? I know, the word radioactive can sound pretty scary, right? But the actual process for RAI is way simpler than you might think. Seriously, it all starts with just swallowing one small capsule with some water. That's it. Now, for a few days, your body will give off a tiny amount of radiation, mostly through things like sweat and urine, so you'll have to follow some simple precautions like flushing the toilet twice. And the most important thing is just limiting super close, long-term contact with other people for a little while, just to be safe. All right, so once you're through that initial treatment, the journey isn't quite over. The focus just shifts a bit. It becomes all about long-term management and figuring out how to navigate this new normal. So here's the really crucial thing to understand. Those two permanent options, radioactive iodine and surgery, they literally flip a switch in your body. You go from being hyperthyroid, with everything running way too fast, to being hypothyroid, where everything slows right down. Now I know what you're thinking. Aren't I just trading one problem for another? And in a way, yes. But hypothyroidism is, well, it's just much, much easier and safer to manage in the long run. It's just a matter of taking a daily hormone pill. Now, Graves isn't just about the thyroid. It can bring on some other challenges too. For about 1 in 3 people, it can cause eye issues, something called Graves' orbitopathy. Think bulging eyes, pressure, that kind of thing. Pregnancy is another big one. It needs super careful management, usually with anti-thyroid meds. And then there's lifestyle, and I can't stress this enough. Quitting smoking is absolutely critical. It's one of the biggest things you can do to prevent the eye problems from getting worse. Okay, and there's one more really important thing to know about. It's rare, but it's a life-threatening complication called a thyroid storm. This is a true medical emergency. So if you or anyone you know with Graves has a really high fever, seems extremely restless or agitated, and has a crazy fast heartbeat, that is a sign to get help immediately. No waiting around. So let's look ahead for a minute. What's on the horizon? What's next for treating and managing Graves' disease? Well, the good news is the field is always moving forward. Researchers are constantly exploring less invasive options. And one really promising idea is something called thyroid artery embolization. It's a procedure where doctors can actually reduce the blood flow to the thyroid. And less blood flow means less hormone production, all without having to destroy or remove the gland. So it's this amazing new non-surgical possibility that's emerging. So what's the big takeaway from all this? Look, Graves' disease is a lifelong thing. There's no getting around that. But, and this is the important part, it is absolutely 100% manageable. With the right treatment and a really strong partnership with your healthcare team, the outlook for living a long, healthy life is genuinely good. And all of this leaves us with one final, really thought-provoking question, one that really gets to the heart of what it's like to live with this. For a condition that's going to be with you for life, how do you find that right balance? The balance between the daily commitment of managing it with meds versus choosing a permanent but totally irreversible solution like surgery or RAI. It's a deeply personal decision, and it's really the core challenge of managing Graves' disease for the long haul.